And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Welcome to Open Connection. I'm your host, Robert Pictou. Our show today comes to you from the traditional and unceded territory of the Tsimshian people. It was established as one of 5 geographically based health authorities in 2001 by the government of British Columbia. The Northern Health Authority operates over 24 hospitals, several long-term care facilities for seniors, public health units, as well as addictions and mental health services. On today's Open Connection, we open our archives with Sharon Downs of Western Health Planning Association.
You see, my mother-in-law died of an aortic aneurysm, undiagnosed as we did not have a CAT scan. By the time she was readmitted and a medevac flight called, she never made it onto the ambulance.
Healthcare is an emotional issue, and sad stories have been among those told by people at a series of public meetings in recent weeks. A pair of consultants is working on a plan to improve the Northwest's health system. In Terrace, people are especially worried about their hospital. It's been plagued by admissions closures due to a shortage of nurses and beds. In Smithers, the shortage of family doctors is an issue, as well as travel for medical treatment. And seniors and their families are concerned about home support services. Consultants Sharon Downs and Dorothy Schiller have listened to all the input. They've also been in on private meetings with numerous groups. Their mandate is as broad as the concerns.
We're looking at programs and services in terms of how they're delivered, those kinds of things that are delivered directly to patients, clients, or residents. Things like mental health, things like specialist care, things like acute care and outpatient services, ambulatory care. So we're looking at those things, but we're also having a hard look at what we refer to as the corporate services, administration and management, financial services, materials management or the ordering and distribution of supplies, that kind of thing, human resources. So everything's on the table.
The location of specialist services has been an issue in the region over the years. The consultants acknowledge it's easier to concentrate specialists, but general surgical services are needed in other communities. As well as holding meetings, the consultants have also been looking at a lot of statistics as part of this process, and they're aware of some problems with the health status of the region's population. Higher rates of substance abuse and teen suicide, for instance.
Specific types of cancer, for instance, lung cancer, that are directly tied back to smoking and secondhand smoke. Accidents, we know there's a very high incidence in all of those areas right across the Northwest, and an even higher incidence if we start looking at the Aboriginal population in the Northwest. Many of those areas are things that we can prevent or that we can change lifestyles or behaviors and thus prevent the illness down the road, or early death in many cases. And we will certainly be addressing those kinds of things, and most likely, I would say, recommending that some additional dollars be put into the whole area of health promotion and prevention.
Community health councils like Terrace's will see a draft of the consultants' report in May. The consultants will likely recommend changes to some services, and they won't be restricted from calling for more funding.
We'll certainly be looking at how we can better and more appropriately utilize the funding that is available now. But if we find a serious gap in the system or in terms of service delivery to the communities, we will have to look at how we can recommend funding increases.
That's right.
Some of the loudest critics of the health system are hopeful this project will result in improvements.
I was sure glad to see an awful lot of people show up tonight. It was really good to see Terrace come out in full force like this on a Friday night. And I think that they're trying to do something, and I really sincerely hope at the end of the term that something, and it's not just shelved.
Once the plan is approved by the Regional Steering Committee, representing the Northwest's health councils and Community Health Services Society, it will go on to the provincial government.
They don't have a specific timeline, but they have been very clear that they want to use this document, as well as the ones that are being developed all across the province, as a baseline for their funding over the next 3 years. So
Downs says Northwest residents could see the first changes resulting from the plan in the fall, but it won't all happen at once. Recommendations will be phased in, so there's limited disruption for healthcare providers.
Open Connection will be right back after these messages. And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Thank you for staying with us. Skeena-Caelum Housing Society, now known as Terra Nova Housing, is a 50-unit social housing complex on Terrace's south side that provides families with subsidized housing. The aim is to ensure people do not pay more than 30% of their income on rent. Let us return to the archives to see how this idea is growing.
A tour group wanders through one of Terrace's affordable housing success stories. Participants at the Northern Reflections on Housing Conference are checking out the Skeena-Caelum Housing Project. Its first phase was built 6 years ago through the efforts of a nonprofit society, the City of Terrace, and provincial and federal governments. Today, some people in the Northwest hope to bring more such partnerships to fruition.
Good morning. It's a real pleasure.
BC's minister responsible for housing opened the conference. She reminded the audience her NDP government has increased funding for affordable housing in the past year.
Just last June, we doubled the annual allotment, which means another 2,400 units. What matters about that, of course, is that 6,500 families or individuals who will move into decent, safe, affordable housing, which improves the quality of their lives greatly. Lang and the Katimavik Youth.
Beyond funding, Pullinger says her government wants to offer other kinds of assistance to groups developing affordable housing. One example is research. A recent report looked into the impact of social housing projects on private property values in a neighborhood.
People are frequently very concerned about what social housing might do to the cost of housing, the value of my house. We've done a report that shows very clearly that it does nothing to the value of your house. Social housing is well built, it's well maintained, and it tends to be an asset, a permanent asset in a community. So we're hoping that that can dispel some of the fears.
The issues surrounding housing are complex, and organizers of this conference recognize that by bringing in a great variety of speakers.
I just know that I want to cover the entire area of housing and health and recognize that it's so important to pull the two together and that we all have to start working together out there in the field. There's a lot of barriers up, not only in government as far as accomplishing things in housing, but there's also barriers in our own societies.
The links between housing and health were addressed right away by the Northwest's medical health officer. Dr. David Bowring says numerous studies since the 1970s have shown life expectancy, illness, and disability are determined by factors far beyond the availability of doctors and hospitals.
And we know that what we think of as health is in some serious, significant difficulties. We read about it every day in the paper. But at the same time, that a lot of people don't realize this, our life expectancy has been steadily, through those years, steadily increasing. And our infant mortality rates, which is seen internationally as a real, key marker of how healthy a population is, have been also steadily going down. So
Bowring says money is good for the immune system. Japan's life expectancies rose dramatically with its economic boom. In Canada, mortality rates also correspond with average earnings. Of course, money can buy better housing.
Health status in the northern parts of our province tends to be deficient compared to the more urban, more southern parts of the province. It's consistent, it's been that case for years, and it remains the case.
Poor health stats in the Northwest correspond with a larger percentage of older homes and homes in need of major repairs. The average Northwest home also contains more people than those in BC's more urban centres. In First Nations communities, like those in the Nass Valley, Bowring discovered early on people understand the link between housing and health.
I asked the people that I was talking to what was the biggest health issue that they saw, and they said housing. And I said, excuse me? Didn't you just see what I just presented to you? You've got mortality rates, you've got alcohol. All of these things that we tend to connect with health. And they said it's housing. And I went back and I've been thinking about that essentially ever since. To to the point where I'm now at a conference, trying to convince other people that housing is a key determinant of health, and it's something that if we work on housing, a lot of the other things will begin to take care of themselves.
Other groups that have a hard time obtaining adequate housing include the mentally ill.
If people sleeping and living outside or in bad situations, it has such an impact on the quality of life that a person basically cannot move forward.
Open Connection will be right back after these messages. And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
Welcome back to Open Connection. Established in 1979, Kasan House Society is a nonprofit organization with a mission of responding to community need through empowerment, assistance, and support of people experiencing gender violence, poverty, homelessness, and other forms of oppression or marginalization. Let us return to the archives with Rudy Small.
The majority of mentally ill clients that get housed are so thankful and appreciative for decent housing since they've gone through many years of living in SROs and SCSI digs that they do very well.
BC's Health Services program provides help to landlords dealing with people with difficult behaviors. It includes a screening process. For people with mental illness and other disadvantages, a range of options is needed, including facilities such as Terrace's Osborne House and emergency shelter. But ultimately, most people want to live in more normal circumstances. A variety of subsidized projects in Prince Rupert, Terrace, Kitimat, and the Queen Charlotte Islands are making quality, affordable housing more available to people on lower incomes. But most of those units are concentrated in Prince Rupert, and right now, many of them are empty.
Basically, the first units were built in 69, and the majority of the other units came on in 76, and it was a political decision at that particular time. There was a lot of, I think, expectation that Prince Rupert was really going to boom. That was when the coal terminal was coming online. And then there was an awful lot of other housing, private housing that was developed at the same time.
The mistaken projections made for Prince Rupert are a lesson to people planning housing projects. That's why advice from experts like demographer David Baxter are so valuable. He's telling people now to pay attention to the growing seniors population in northern BC.
There's the age profile today.
Baxter's graphs show the bulge of the baby boom moving up into the older age groups. The leading edge will hit retirement age in about 6 years, with a peak 30 years from now.
So we come to a situation, according to this forecast, where natural increase in migration will essentially hold the bottom of the pyramid constant, but enormous increases in every age group over the age of 45, not as a result of people over the age of 45 coming here, but as a result of people who are currently under the age of 45 staying here.
Another phenomenon may also boost the number of seniors living in the Northwest. That's the people Baxter calls equity refugees from large urban centers.
As we get into an environment where, in the country as a whole, we are faced with significant restrictions on funding seniors' populations, healthcare, and income transfers, there's going to be an enormous incentive for people of retirement and pre-retirement age to sell the big house and move, take their equity and move to smaller communities.
Baxter says older seniors will likely increase the demand for rental apartments. But he points out most baby boomers live in homes they own rather than rent, and they'll continue to be homeowners into their retirement.
You see, a lot of these people are going to be living in single detached houses. The issues for them will not be a housing supply issue per se, but perhaps the garbage gets picked up and they can't carry it out.
Supporting seniors living independently is a goal of a housing project almost ready for construction in Terrace. Residents of Terrace Mountain Manor will have a caretaker on site and be able to get some services at neighboring Terrace View Lodge. BC Housing has agreed to subsidize some of the units.
And one of the things we're really critical for us, really trying to do well, is ensure there's a link between self-contained independent units for seniors, where there's no supports, and a form of multi-service, multi-care type of environment in the health system. There's nothing really in between. We really want seniors to be able to live longer in their homes, and this new program, Support of Seniors, allows them to stay there because you get input of meals and some light housekeeping and some 24-hour staffing just to stay there.
Other communities are also looking at the needs of seniors.
We're exploring a seniors complex in the village of Talquah, so we wanted to see how this would fit in with the plans and the growth within our community. And it was a very informative conference, and I'm really glad that we've got here lots of good information. So we're going to proceed down the road with the seniors complex, the application thereof anyway, and explore working with other communities. It seems to be the flavor of the day for British Columbia, which is fine. We should spend our tax dollars the best way we can.
Community leaders, government reps, municipal staffers, and others at this conference have gone away with a lot to think about. But enhancing partnerships is certainly one of them. That means forging more links between people working on health and housing issues, plus connections among government, various community groups, financial institutions, and private businesses that can address the challenges ahead.
Open Connection will be right back after these messages. And now, from the CFTK-TV studios, this is Open Connection with your host, Robert Pictou.
In 2013, a young man from Poland let his craving for sausage get the better of him. Garlusz Garlobek, originally from Poland, started a fire in his sister's living room by lighting a disposable barbecue in an attempt to cook some sausage. In this final segment of Open Connection, we return to the archives with former Terrace Fire Chief Randy Smith with some precautions to prevent your cookout from going up in smoke.
The snow is gone, the ice has melted, and we're starting to see the first colors of spring. That means it's time to get back outside. It's time again to light up the barbecue, but before you crank on the gas and fire up a match, there's a couple things you need to check. If you don't, something like this could happen.
It was simply a leak in a propane line, and the propane built up, and when it came in contact with a spark, or in this case it was a match being struck, it was ignited. And I think that, it's the spring is come, and we're dragging out the RVs and the barbecues as we have here, and really what it takes is just a few minutes of your time to go over the equipment that you have and make sure that it's ready and serviceable for the summer. Propane.
As you can see, this barbecue has spent the winter outside. It might not be in the same shape it was last time it was used, so to avoid any accidents, there's a short check you can do.
First thing you want to do is take a look at your propane tank. Is there any damage to it? Did something hit it over the winter? Does any major dents or scratches in the tank? Generally, when we find that there's a problem with the propane tank, it's with the valve and it's been damaged somehow. And so you want to check and make sure that is correct.
After you make sure your tank is in good shape, move on to the connector hose.
Is it dried out? Is it cracked? Does it need to be replaced? You just want to look at it. And I would recommend that if it's looking old and weathered and cracking, replace it. It's not an expensive item, and it'll be worth your while because again, propane can be kind of a sneaky gas, and you don't want to leak.
If everything looks good on the outside, then you're ready for the soap test.
You turn your propane on all the way, and you just go over the connections, and if you use a soapy solution and you spray on there, you should see bubbles coming up if there's a leak. And you can just check all your connections there. Looks good. Go through, and then just underneath the connections there, and look for bubbles. And that's going to let you know whether there's propane leaking and save you some problems down the road.
If everything looks good and there's no gas leaking anywhere, it's time to fire it up and start cooking. But before you do that, there's one other thing you need to check. That's the sun deck your barbecue is sitting on. It might not be in the same condition it was last summer either.
Things in particular are your
guardrails to make sure that they haven't rotted out and you're exposing your children or people leaning against them for it to accidentally fall and snap. From your main structural members, same thing. You should be checking your beams to make sure they haven't sustained any rot, and if they have, get them repaired, get them replaced. Same with your posts, your stair stringers, same thing. When they're exposed to weather, they tend to rot if they're not properly treated or protected, and even those ones should be checked on a regular basis. Okay, the next thing you want to check specifically on the beam is you want to check to see that this part of the beam here is in good solid shape, but you should be checking in the middle of the beam where the water will sit. It may get a little bit of rot on the end, but it's got a lot of meat here and it's directly under support. The things that you need to really concern yourself, if it's rotting in the back, behind. So you need to make sure you get in there and you poke around and you check.
One chief owns a trapping ground, hunting grounds that they use among their families. And we want it to stay that way. We don't want any change in it.
About 20 people came out today, members of the Kispiox Watershed Protection Coalition, Giksand Chiefs, and Steelhead Society representatives, to say there will be no logging past this point.
This is the last chapter in the book of the abuse of the Kispiox River. It's Groundhog Day 1995, and Mr. Harcourt, the ministry, they should know now that the line is drawn here.
I just can't believe, after 22 years, with all the people and the input that's been on this area, and time again, the people of Valley just can't believe that this hasn't been set aside. They've been promised it's set aside before. They've been promised there's no roads and logging in the area. And you wake up and they're at it again. Now, we can't go any further because this is the upper watershed. There's nothing left after this.
No longer want to support the greed and the benefits that our timber provide for the lower mainland. This is the economy that we want to look after up here. And we are taking this part of the forestry out of the AAC. There is no longer going to be any cutting in this from now and for the next 10,000 years. So this is it, Mr. Harcourt. There's no more logging in this area.
We've never been opposed to resource harvesting of any form. We just want a more responsible approach, a more responsible attitude towards it. We have to protect the habitat for all the users of this area. Fish live here, animals live here, wildlife abounds. Sure, there's trees that have economic value, but there's more to the region than just that economic value in trees.
It is without a doubt, in years past certainly, probably the world's finest steelhead dry-fly fishery, and is known throughout the world. You cannot afford to lose this. I mean, let's talk about local economics. The local economics of this community are based on renewable resources, as they should be. This is not renewable resources. This is not good management.
Nobody here is expecting any kind of confrontation, but they say they'll do what it takes to keep the watershed from looking like this.
Thank you for joining us for this episode of Open Connection. The greatest distance in the existence of man is not from here to there, but the connection from his mind and heart. If we can conquer that distance, we can soar like an eagle and realize our immensity within. I'm Robert Pictou.